Hi everyone, Vlad from Deansgate Osteopathic Clinic here. Today we're going to talk about sciatica and the causes for sciatica. Sciatica in itself, we feel it as pain going down the back of the leg, possibly pins and needles and numbness with that as well. To cause that symptom, what causes that symptom is pressure on the nerve itself, whether that's the nerve roots or a portion of the nerve anywhere along where the nerve runs. So let's talk about the three most likely culprits. We're going to use this miniature spinal model here. So this model is as if you're looking at somebody from the front. We can see the spinal bones, the vertebrae, and the discs in between. So if we come in for sort of a closer look, this red portion here is a disc bulge. Essentially, that's the disc sort of bulging out. Very commonly, that's called the slip disc, although we prefer disc bulge. That disc bulge can be pressing on the nerve root of one of these nerves that come out of the low back here that form that sciatic nerve. And that pressure in itself can cause that, the sciatica. And we experience that symptom, as we said, as pain down the back of the leg. Now, if we look at where the nerve root is, in sort of behind it, we have the spinal joints. Now, these spinal joints, either through overuse, sort of repetitive strain overuse, or through perhaps a more of a traumatic kind of accidental sort of onset, they can get irritated, inflamed, which generally brings with it swelling, and that swelling can press on the nerve root also, again causing that sciatica. So that's possibly one of the second most common causes. Now, last but not least, we've got these nerve roots come out of the spine here. These ones in the low back and these ones in the top of the sacrum, and they come together to form that sciatic nerve. Now, right above where the sciatic nerve is about the size of a thumb at its thickest, we've got the buttock muscles. Most notably, the ones that we're interested in, the one we're interested in most is called the piriformis, which essentially is touching that nerve in itself. And if that muscle gets tight enough, that pressure between the muscle and the bone can actually pinch that sciatic nerve enough to cause those sciatic nerve symptoms. So that's most commonly referred to as piriformis syndrome. So there we have it. Those are the three really common reasons why you'd get sciatica. For our next video, what we're going to do is we're going to actually show you what it is that we do in clinic in order to ease off the symptom. So in order to take as much of the pressure off as we possibly can off of that sciatic nerve and relieve that sciatica.